Hello, I'm Dr. Hong, dermatologist in South Korea. It's my honor to present here. Today, the topic of my presentation is Ultimate Skin Rejuvenation with New Microfocus Ultrasound and Radiofrequency Synergy Technology using the new DOUBLO. New DOUBLO is multi-platform that we can use bipolar radiofrequency and microfocus ultrasound. This presentation is sponsored by HIRONIC company. We are using a wide range of devices for various purposes. For treating pigmentation, we usually use different lasers such as Nd:YAG, alexandrite, and IPL. To address wrinkles, facial sagging, we commonly use radiofrequency and microfocus ultrasound device. But I have been using radiofrequency and microfocus ultrasound for more various purposes beyond just facial lifting. Recent studies have revealed that thermal rejuvenation is important in pigmentation treatment. It has been discovered that senescent fibroblasts are real enemy behind melasma. Therefore, when treating or preventing pigmentation, it's important to pay attention to treat senescent fibroblasts. I think radiofrequency and microfocus ultrasound are important devices for addressing tissue issues. Actually, there are reports suggesting that microfocus ultrasound can be used in pigmentation treatment, such as melasma. But I think that microfocus ultrasound alone is not sufficiently effective. It is important to use microfocus ultrasound combined with other treatments to enhance the efficacy and prevent recurrence. There are also researches suggesting radiofrequency can also inhibit melanin synthesis and be effective in treating melasma. This shows that both microfocus ultrasound and radiofrequency are important tools for addressing most issues that may arise during the aging process. So I believe these two devices are essential equipment in our clinic to treat all aging process. If so, if radiofrequency and microfocus ultrasound are used together, could there be a synergy effect on the outcome of skin rejuvenation? The answer is absolutely yes. Leaving the studies on the combined treatment of microfocus ultrasound and radiofrequency, it has been reported that when radiofrequency is applied after microfocus ultrasound or microfocus ultrasound is applied after radiofrequency, tissue responses are more extensive compared to standard alone treatments. If the tissue responses are more extensive, it can be expected that the clinical effect will be better. In Korea, many doctors have used radiofrequency and microfocus ultrasound device together on the same day for better clinical effect. As we know, microfocus ultrasound stimulates collagen synthesis by forming hit points at around 60 degrees Celsius. Rather than immediate effect, clinical benefit become evident as tissue undergo remodeling in the following 1 or 2 months. We need to explain to our patient that the result of microfocus ultrasound procedure will gradually become apparent over time. What about RF? There are various types of RF devices used in dermatology. Among these, bipolar radiofrequency is commonly used in dermatology clinic because it is to use and has minimal side effect even though it doesn't penetrate deeply and doesn't provide long-term effect. Bipolar radiofrequency does not raise the tissue temperature enough to trigger collagen contraction mechanism or well-known mechanism of RF. Typically, it induces the secretion of hyaluronic acid within the tissue at around 42 degrees Celsius, creating short-term edema, enhancing tissue turgor. So it shows immediate improvement after the procedure, but it tends to have limited long-term effectiveness. If so, what would happen if we simultaneously perform bipolar radiofrequency and microfocus ultrasound procedure? not sequentially, but at the same time. HIRONIC company has developed this technology under the name Synergy Dotting. The Synergy Dotting is the first technology globally to allow us to apply radio frequency and microfocus ultrasound at the same time on the skin. We believe that when microfocus ultrasound is applied to tissues heated by bipolar radio frequency, it would induce more tissue reactions, leading to superior clinical effect. Furthermore, when employing synergy dotting technology, early stage immediate effect can be observed. Radio frequency increases hyaluronic acid in the tissue, leading to short-term edema and improved tissue turgor. In the later stage, synergic effect of bipolar radio frequency and microfocus ultrasound on collagen synthesis become apparent. Therefore, patients who undergo synergy dotting technique can experience both immediate effect and long-lasting skin rejuvenation effect. Using bipolar radio frequency and microfocus ultrasound simultaneously can complement each other's disadvantage and enhance the efficacy of treatment. The star of today's presentation is a new DOUBLO which utilizes synergy dotting technology. As you can see, new DOUBLO offer a variety of handpieces. The FL cartridge provides the well-known microfocus ultrasound dot mode. With SD cartridge, we can simultaneously use bipolar radio frequency and pen-type microfocus ultrasound. It can be used separately. We can only use microfocus ultrasound or bipolar radio frequency. Providing two handpieces for each cartridge type, it allows us to continue with the next procedure without changing cartridge. Korean clinics are so busy, so these options are essential. For facial treatment, the FL cartridge can address depths of 1.5, 2.0, 3.0, and 4.5 mm. The SD cartridge targets depths of 1.5, 3.0, and 4.5 mm. For body treatment, the FL offers cartridge for treating depths of 6 and 9 mm, while SD provides a cartridge for treating at 9 mm depths. During the FL cartridge procedure, the motion sensor is attached, so if the contact is not good, the procedure stops to prevent side effect. Now, let's take a closer look at synergy dotting technology. In the center of pen-type cartridge, one dot of microfocus ultrasound is delivered at maximum speed of 7 Hz, while bipolar radio frequency is simultaneously applied in the surrounding area. Since this technology uses bipolar radio frequency and microfocus ultrasound, it can reduce the risk of downtime and complications. When doing procedure with the SD cartridge, bipolar radio frequency plays a role in raising the tissue temperature to around 42 degrees Celsius. As seen in the image, microfocus ultrasound is delivered into skin where the temperature has increased due to RF. As a result, MF heating point is better formed and clinical efficacy is increased. As seen in the slide, when comparing the effect of microfocus ultrasound alone and combined microfocus ultrasound and radiofrequency treatment using SD cartridge in the tissue, the group undergoing combination treatment showed a significantly higher production of collagen. Similar to conventional microfocus ultrasound, SD 4.5 primarily targets the smooth layer, while SD 3.0 focuses on the fibrous layer of fat, and SD 1.5 mainly targets the dermal layer. This is my article. To examine the clinical effect of synergy dotting system, we conducted a 3-phase trial with a sample of 20 individuals. Let's take a close look at the detailed result of the study. Participants received MFU-only treatment on the left side and combination of MFU and RF on the right side of their face. SD 4.5 and 3.0 were applied to lower face, while SD 1.5 focused on the forehead, around the eyes, and mid-face for rich areas. Evaluations were conducted at 8-week post-treatment intervals, assessing factors such as pore size, skin elasticity, eye wrinkles, nasolabial folds, cheek lifting, and jawline lifting. As shown in the image, we observed a 62% greater improvement in eye wrinkles in the combined treatment group compared to the group that used MFU alone. In the case of skin pores, there was 69% greater improvement in the combined treatment group compared to the group that used MFU alone. In the case of dermal density, there was 43% improvement in the combined treatment group. This indicates that more collagen has been generated in the dermal layer in the combined treatment group. For the improvement effect on the jawline, there was 31% improvement observed before and after. The treatment effect on nasolabial lines showed a relative modest difference compared to other clinical parameters. We assume that this is due to the limited synergy effect of bipolar radiofrequency and microfocus ultrasound for lifting treatment. It may be difficult for bipolar radiofrequency to effectively be delivered at depth of 4.5 mm for synergy effect. As seen in the table, the combined treatment group demonstrated superior effect in the most clinical parameters such as skin contouring, elasticity, skin pores, and skin moisturizing effect. We can experience treatment effect of microfocus ultrasound and radiofrequency in the only one session when using synergic dotting technology. Here is another report from Dr. Kim in Korea using SD 3.0 to treat low eyelid laxity. He reported improvement in the lower eyelid laxity of 2 cases using SD 3.0. Considering skin thickness around eyes, I think both SD 1.5 and SD 3.0 are effective treatment options for addressing periorbital aging. Now, let's take a close look at how to design and use the SD cartridge. Everyone's face is unique, so when performing procedure, it is necessary to customize the design of the procedure based on the anatomical location, age, and weight of the patient. As seen in the graph, SMAS is buccal region is positioned deeper compared to the pre-mesothelial region. The depth of SMAS was found to increase with higher BMI and decrease with advanced age. So, especially when doing SD 4.5 treatment, it's best to customize treatment area based on the patient face. If the patient is young, has more facial fat, we have to treat more broad area using SD 4.5 and targeting SMAS. But for those with thin skin and less fat, it's better to focus SD 4.5 on anterior cheek area. Sometimes patients with too little facial fat volume may skip the SD 4.5 procedure. SD 3.0 can be used to target the SMAS layer in people with less facial volume and thin skin, and it can be used for treating pores or wrinkles around the eye. SD 1.5 is effective for dermal rejuvenation across the entire face, including neck, forehead, and eye area. Let's watch a video on designing and performing SD treatment. Initially, we determined the area for treatment with SD 4.5. We mark and exclude areas that may cause mental lobe damage. As mentioned before, if the patient is young and has excessive fat volume, treat wide area with SD 4.5. However, if the patient has minimal facial fat, we may skip SD 4.5. The procedure is so easy. If the patient feels too hot, we can either reduce the intensity of radiofrequency or move more quickly. During the SD 3.0 treatment, we target the jawline, mid-face, and around eye areas, while SD 1.5 is used for entire face including neck area. After the procedure, face may appear red and swollen, which is normal reaction. Let me share my best treatment program using SD. One approach involves combining laser toning with SD 1.5. SD 1.5 helps improve pigmentation quickly and suppress recurrence. Initially, we perform laser toning every 2 weeks along with SD 1.5. After improvement in pigmentation, we switch to SD 1.5 only treatment every 4 weeks. The second method is applying SD 3.0 and 4.5 before standard MFU lifting for additional effect. Combining SD treatment with conventional MFU yields enhanced immediately patient satisfaction and improved clinical outcomes. Now let's move to clinical cases treated with SD cartridge. This female patient visited my clinic to improve her lower face. She underwent 3 sessions of SD 4.5 and 3.0 treatments with conventional MFU 400 lines on her lower face at 1 month intervals. As seen in the photos, you can see the overall improvement in the lower face lines and lifting effect on her lower face. This female patient visited my clinic to improve chin and neck line. She underwent 1 cc of chin filler, followed 3 sessions of SD 4.5 and 3.0 treatment with conventional MFU 400 lines at 1 month intervals. An observable improvement in the jaw and neck lines was noted. Since SD 1.5 demonstrated maximum synergy effect in the previous article, I frequently use it in various clinical cases. The female patient had persistent melasma recurrence even after laser toning. She underwent 10 sessions of SD 1.5 treatment with laser toning at 2 weeks intervals. The treatment was successful and she has been maintaining the result without any recurrence. She is maintaining only SD 1.5 treatment once a month. As seen in the photos, this patient shows improvement not only in pigmentation but also in overall skin elasticity. I think treating only pigmentation is like just applying wallpaper to a leaking house. To prevent leaks, waterproofing work is necessary. Similarly, I believe that the fundamental treatment for pigmentation is dermal rejuvenation. Recurrence of melasma is associated with dermal changes such as senescent fibroblast and solar elastosis. As SD 1.5 treatment promotes dermal remodeling, it has the potential to prevent the recurrence of melasma. So I do SD 1.5 treatment at month intervals after observing improvement in pigmentation. Here is another female patient who came in with persistent inflammation, discoloration, and wrinkles on her face. Like the previous case, she underwent 10 sessions of laser toning and SD 1.5 treatment simultaneously. We can see a general improvement in skin elasticity, reduction in wrinkles, and refined pores, leading to brighter complexion. Similar to previous cases, she underwent 10 sessions of laser toning and SD 1.5 treatment 2 weeks interval. We observed the same improvements in pore size, skin elasticity, pigmentation, and skin tone. I think SD 1.5 is most attractive at new DOUBLO. It's safe and easy to combine with various treatments. It shows various treatment effects such as reducing wrinkles, pigmentation, inflammation, and skin pores. This is last slide. The new DOUBLO is multi-platform device that use both microfocus ultrasound and radio frequency. The synergy dotting system is the first technology globally to allow us to apply radio frequency and microfocus ultrasound at the same time on the skin. This device offers a safe and easy way to achieve outstanding skin rejuvenation effect. Thank you for your attention.